Oh, welcome back again. This is Dr. Noah, your host of Dr. Noah's 21st Century Hardcore Health. And today, with all the exposure in terms of swine flu, let's just talk about good immune system. Regardless whether you have a cold or you have a sore throat, you have swine flu, whatever you have, your immune system is your most important factor. And ultimately, that's what's going to make you either recover or ultimately what's going to make you kind of basically die. So why does the immune system falter? So there's basically different types of immune dysfunction, common type of signs and symptoms that your immune system isn't working right. You have lots of colds and flus. Usually no more than one or two. Myself haven't had a cold or flu in over 20 years. Frequent ear infections, sign that your immune system isn't working. Slow wound healing, unexplained fatigue, history of cancer. These are all factors that can have a part to play in terms of your immune system. So what can have to have an impact? The acronym is PITS, P-I-T-T-S, poor nutrition, infection, toxins, trauma, and stress. Any of those factors can have an impact in terms of whether or not you're going to be healthy or well. And so we want to make some changes there. So behaviors that increase poor immune function, excess sugar. We got the Lancet study, probably about 15 years ago, that taking lots of sugar, say like a soda, 8 to 12 teaspoons of sugar, suppresses your immune system 50% for about 5 to 6 hours. So that makes you more vulnerable. Eating foods that are low in vitamin A, vitamin C, and zinc can suppress your immune system. Excessive stress, we all know that cortisol, the killer hormone, can bring down your immune system over time. Trauma, whether or not it's an accident or surgery, can decrease that. And of course, frequent exposure to infectious agents can have an impactor. So every severe chronic disease is directly associated with the immune dysfunction. So we want to basically try to modulate your immune system. We don't want your immune system too high. That can turn into an allergy, asthma, or an autoimmune. We don't want too low. That can cause different types of problems like that. So when the immune system is challenged, you can have different types of allopathic type of signs and symptoms like irritable bowel syndrome, arthritis, rheumatoid arthritis, chronic fatigue, yeast infection, hepatitis, chronic colds and flus, sinusitis, or just to name a few. So the immune system is actually a circulating nervous system which defends the body against invaders by recognizing the problem, friend or foe, responding to the problem, hopefully be able to destroy if it's an enemy, and then remembering what to do so the next time that's able to respond very quickly. Well, one of my favorites is that chiropractic adjustments. This in Chiropractic Research 1994 looked at HIV patients and looked at a CD4 count. This is a blood test. Doesn't matter whether it's your chiropractor, drug doctor, osteopath, whether or not you do herbs. CD4s are an indication of your immune system. Well, after an adjustment to the upper cervical area, they were able to show that CD4 counts were able to increase by 48%. Very dramatic, very, very effective. Then in the Chiropractic Journal of Australia in 1993, reviewing the scientific literature, showing that adjustment, once again, adjustment basically influences the nervous system. And as we talked about, the immune system is the floating nervous system. It was able to increase T and beta lymphocytes, natural killer cells, antibodies, phagocyte activity, plasma beta endorphins. So these are, once again, chemical type of tests and markers that is influenced by just basically wishful thinking, whether or not the treatment, whether or not it's a chiropractic adjustment or a nutrient or drug, will either increase or decrease those, and that did. Another study in Journal of Manipulation and Physical Therapy in 1992 enhanced neutrophilic respiratory burst, kind of an explosion that occurs killing different type of pathogens. So very, very effective. Well, it's not just chiropractic. Osteopathy has a long history in terms of understanding that an osteopathic manipulation is able to influence the immune system. So in this study in 2005 in International Journal of Osteopathy, they were able to show with HIV patients and funded by the National Institute of Health that osteopathic manipulation did indeed increase the immune system to be able to fight that. And another health profession, naturopathic medicine, was able to show it with the Canadian AIDS Treatment Information Act or study showing that the manipulation did have an impact in terms of helping the immune system. Nutritional support, I like vitamin A. That's been used since the 1920s as an anti-infective vitamin. Lots of research on that. Vitamin C from the Oregon State University showed that 1 gram per day cut colds by a day, one day. Now, if you remember, the swine flu is the very expensive $300, costing billions of dollars, the Taxiflu medication, antiviral. That's been shown to reduce the signs and symptoms of swine flu by 1 day. Here's 1 gram was able to show in colds reduced. Japanese studies showed in randomized control study, European Journal of Clinical Nutrition 2006, that 500 milligrams per day cut colds down by 66%. Let's not forget vitamin E, a fat-soluble vitamin. This is only from the Tufts University study looking at elderly people over 60. 200 international units for 1 year was able to reduce for elderly over 65 20% reduction in colds. And that was only published in the Journal of American Medical Association 1997 and 2004. Zinc, another favorite, has been shown to interfere with replication of viruses. So that taking zinc lozenges within 24 hours of colds of onset was able to reduce the cold from 9 days, which is a traditional type of allopathic drug approaches, versus 7.5 days. And that was from Case Western Reserve University. Annuals of Pharmacology Therapeutics, 1996. Journal of Pharmacology Technology, 1995. Cleveland Clinical Journal of Medicine, January 1999. Archives of Internal Medicine, 1997, just showing that zinc. Being in the wine industry and wine country, grape seed extracts were shown to be helpful in terms of increasing natural killer cells and the cytotoxicity of that. Mushrooms, for this happened to be fermented 2 months of use in terms of increasing natural killer type of reaction. Whey protein, another one of my favorites, what's called bioactive proteins, a little bit level above whey type of proteins, shown effective in terms of helping different types of making the immune system stronger, improve GI health, lower cholesterol and lipids, increase muscle mass, and improve quality of life. Elderberry, from studies from Israel, 1 tablespoon, 3 to 4 days less for flu, Journal of Agricultural Food Chemistry 1998, and other ones. So those are just some different types of tips that you can have in terms of trying to make some changes. Some other ones that I like is beta-1316 glucan, which has been shown. There's mixtures of different types of Chinese mushrooms that have shown very, very effectiveness in terms of reducing colds, flu, viruses, but also bacteria. I like a particular type of garlic from Europe that actually is used against the antibacterial resistant type of bacteria out there. Also with flu, they've been used with anthrax, very, very effective. So these are some things that give you some effective things. We don't want to forget just the basic hygiene. A couple years ago, the British Medical Journal reviewed the scientific literature for the last 160 years, and the greatest breakthrough was not some genetic engineering, biotech type of thing. The discovery of antibiotics was just basically good public health hygiene. Wash your hands, clean water, clean air have a big factor in terms of your health and well-being, so be careful about that. So once again, thanks for watching my YouTube here, and keep up to date to be happy, healthy, and prosperous. Thanks.